Hey everybody, Brian Gallagher here in my home office, and I just wanted to really quick put together a video for you as a vlog and an associated tip sheet for you to take advantage of as you're struggling in getting through these hard times with COVID-19 virus. First of all, if you haven't had a staff meeting with all of your staff and explained to them what they can do to make a difference, you should do that. If you haven't contacted every single one of your patients and called them and shared with them what precautions you're taking in your clinic, how safe your clinic is, what your disinfection systems are, and how you're proceeding in today's new environment, you ought to be doing that. You should also be following up with emails to all of your patients. Let's face it, we all have several patients who absolutely need physical therapy. Their condition's going to worsen. Their risk factors are going to get worse if they're not seen. So let's just take upon ourselves, as long as they're not a high risk and as long as we don't have any risk in our clinic, let's try to make it a safe environment for them to come in. That's why I'm shooting this video. I'm going to give you some of the tips off of a tip sheet that we recently made that should help you to survive and thrive to the best of your ability throughout this horrible time that we're currently dealing with the coronavirus. So number one, telehealth services are being expanded, and the word you want to really focus in on is coverage and reimbursement, that they are actually going to mimic the coverage and reimbursement for both telehealth services as well as live services. So you need to check that out per state. I recommend you contact TelePT Solutions. They will do this work with you. They will make sure that you're set up on a platform and you can do it HIPAA compliant and legally. So start reaching out and learning about how you could bring that service into your clinic. I think that'll help you and serve you well. Number two, you should have 4 major departments of your focused concern. 1, how can I screen these patients before they come? Number 2, what do I do upon their arrival? Number 3, how are we going to treat them when they're here? And number 4, what practice management strategies should I employ? So I have a full-blown sheet. Like I said, you can go to our website and get it. You can email us at info@megbusiness.com and we'll get that to you. But in with this video, you should see the links that you can click on the link and get it through our landing page. What do you do before they come? You need to screen them over the phone. You need to ask if they've traveled out of the country or if they've gone to any high-risk area within the country like Seattle or New York. If they're having any flu-like symptoms, you need to screen them through the phone by interviewing them to see that they are not experiencing shortness of breath or fever or achiness or cold-like symptoms. That's really important. Ask them to take a self-temperature. Make sure that their body temperature is below 100.3. That's important to do, and you can do all that before they come. When they do arrive, let them know that you have shut down your waiting room. You no longer have a waiting room. The parking lot is the waiting room. They're to call you when they arrive. Caregivers stay in the car. Your therapist will wave them in when they're ready to come in, when their appointment's ready, or the front desk person will. They come straight on through, go right to their therapist. They continue their therapy with that therapist, and then they go right back to their car. No caregivers are allowed to sit in our waiting room. Stagger your schedules. This is what we're going to do inside our clinic. We're going to have staggered schedules, so we're going to minimize the number of people, human-to-human contact. We're going to maintain a 6-foot distance between patients and between therapists when possible, but that's not always possible. So when it's not possible, the therapist is going to use gloves, and they're going to use all the disinfectant routines and policies and procedures that they have in place. You should post those policies and procedures on your waiting room front door. You should also be putting it on your website. You should also be letting people know when you call them that you have advanced procedures that you're following inside your clinic to keep them safe. Make sure that they know to bring their own pen so that they can sign any documents that need to be signed if it's their first appointment. We're not going to be sharing pens. Let them know that operationally you may be seeing 1 patient an hour. That you're going to have hand washing and hand sanitizer throughout the clinic. You're going to be disinfecting beds and materials and equipment before and after each person's care. These are really important things. One of the other strategic operating things you can do is eliminate all cloth surfaces, all foam rollers that are not covered in vinyl that could easily wipe down and disinfected. You can't use. You don't want to have foam handles. You don't want to have cloth surfaces. Try to eliminate that, go through your clinic and put that all in a closet. Practice management. onto the practice management side. As a business owner, don't shut down your clinic. Unless you're in ground zero and it's quarantined and something like that, do not shut down your clinic. Stay open for business. Stay open for the healthy people who are not contaminated, who've gone through your screening process when they come into the front door, per the sheet I'm going to give you, that they've passed your interview questions. There's no risks of your personnel. There's no risk to them. Bring them in, follow the proper precautions. As a practice management, do not lay off all your staff. Downsize your hourly staff to meet the needs of your caseload. Ask people to volunteer to reduce their hours if they could. Some people can afford to do that better than others. It's just the reality. So let's see if we can pull together and help one another out. Prorate salaries if you need to. People are salaried, prorate their salary during this crisis. Have a staff meeting and educate them that these policies and these changes are going to go in effect on a month-to-month basis. You'll make adjustments at the end of the month. But you have to stay viable. You have to do what you can to see the people you can. That's what we went into business for. If you can set up telehealth and do telehealth services and do screens through a HIPAA compliant platform, then by all means do that. Like I said before, we recommend that you go to www.teleptsolutions.com, and I think that group will help you quite nicely in getting through what you need to get through. Home exercise programs, EMR templates, audits, updating your P&P manual. These are all special projects you can assign to staff since there's not as many patients to treat that you can get caught up on. Your professional enhancement. MEG Academy is virtual training. It's 24/7. This is a perfect time for you to get through the certification programs we just rolled out, to get through the CEO training, personnel management training, billing training, marketing training. Get through that. Take advantage of your education in this time when you're not so busy running around treating patients if you can. Eliminate non-essential personnel. Techs. If you're going to be treating patients 1 hour, you don't need a tech. Marketing staff can be reduced. Work from home. Let them work virtually. This is really important. If in fact you have a busy inner city kind of office, you can have your front desk take calls from home and route the patients in. Let's minimize the amount of human-to-human contact. So the last message I have for you is financial. You ought to be looking at your QuickBooks and going through the QuickBooks ledger and reducing any line item expense that you can get rid of. Get rid of it. Just stop spending in any area that you don't need to be spending in. Increase your line of credit. If you don't have a business line of credit, this is a perfect time to go get one. If you do, then ask for an increase. So there's my tips just for you on this video to get you started, get you thinking in the right direction. I have many more details in the sheet for you to have, the tip sheet I'm referring to. Take time, go out there and get that sheet. And above all else, you may have specific concerns, questions, considerations going on in your office. We're here to help you. If you're a client, not a client, does not matter. Go to MEG, put yourself in the calendar. www.megbusiness.com. Put yourself in the calendar. We'll get on and help you. Email us, info@megbusiness.com, and we'll set something up with you. Let's pull together and do our best to help each other, and most of all, help the people in our community get the physical therapy services that they deserve.